Auzubillahiminashaitanirrajim. Bismillahirrahmanirrahim. So today I'm going to tell you a few recall points for Neisseria gonorrhea, not the whole topic. Okay, so Neisseria we have 1, 2, 3. Okay, the countdown till 3. 1 is 1 week. So 1 week is that the couple has to abstain for 1 week after the completion of treatment. Okay, after the treatment has been completed, still they have to abstain for 1 week from the day of completion. 2 is 2 weeks. So what is 2 weeks? 2 weeks is contact tracing. Okay, you have to do contact tracing backwards from the last 2 weeks. Okay, what is 3? 3 is not weeks, 3 is days. Okay, so we have 1 week, 2 week, now 3 days. What is 3 days? 3 days is 72 hours for test of cure. Okay, that after 72 hours you have to perform the test of cure. So in whom do you have to perform the test of cure? And basically not in all the patients, for the ones who have persistent pharyngeal symptoms or persistent clinical symptoms despite treatment. And you also have to do in those in which you have given ciprofloxacin as a single dose, okay, and you don't know the sensitivity. Okay, then in those in whom you have given ceftriaxone, you don't have to do it, but in whom you have given cipro, you have to do it. Okay, so 1, 2, 3. Now the other thing is that it's a diplococci. Okay, so there are 2 cocci visible, so instead we can say 2 C's. Okay, so 1 C is for ceftriaxone, other C is for ciprofloxacin. The thing is that gonorrhea is so gonorrheic, it's so horrible that you just, the doctor gets scared and the doctor says just give 1 dose and leave. Okay, I will just give 1 dose. Okay, I'm not gonna give a weekly dose and blah blah. Okay, this is just for remembering. Okay, so the treatment is going to be a single dose treatment. Okay, so 1 dose of ceftriaxone injection, IM, stat, or ciprofloxacin 500 mg orally, single dose, but only if clinically appropriate. When you already know that this is going to be susceptible to cipro, you already know the sensitivity. Okay, you have done the culture and you know the sensitivity. Otherwise you're going to do the test of cure. Okay, and the third C, there's also a third C, not just 2 C's, not just diplococci, a triplococci has entered, and the third C is cefixime, and you're going to give 400 mg. But this is not as a single dose, this is 2 doses. Okay, other 2 single dose. Okay, we are very scared, we're just going to give 1 dose and ask the patient to go and never come back. That's a very bad way to remember things, but yeah. And how we're going to diagnose them? Via culture or NAT. So we're going to do NAT on the culture that we have, on the specimen that we have obtained. Okay.